good evening, God Radio people. As you know, we are your station that is up for a Stellar Award this year because we have great programs such as the one that we have this night, and that is Ask Dr. Follow. Well, I'm going to start off and, this. First of all, Dr. Follow, I want you to introduce yourself, introduce your guest who's really a team member, and then we're going to get right into it because I got some juice for y'all today.
Sounds good. Well, I'm Dr. Susanna Afflalo, a family physician. Worked at Kaiser for 25 years and now the medical director for IWC Primary Care. And with me today is my partner in crime, nurse practitioner Danielle Gordon, who is the leading nurse practitioner over at our primary care clinic, IWC, in Spring Valley.
Well, I got a beef with Miss Gordon, and that is that her supporting cast, who we love, the children and the team, they not with you tonight. And I thought for sure I was gonna get my kid fixed today,
Aw.
and but I didn't get it. But I just want to let you know I'm glad that you are here. Good evening to you.
Good evening to you as well, Dr. Thompson.
Well,
And shout out Sahara Zaire and Mr. Grady.
There you go. There you go. So I'm just going to jump in because I got some questions before we get to our topic tonight. And that is, Dr. Follow, you travel the world and you do all these wonderful things. My question is, how do you stay healthy and not bring home everything from over where you come from?
Good genes. No, I
Okay.
think just eating well. I can't say I rest well enough, but eating well, staying active, and doing my best. I did wear my mask on my trips
Uh-huh.
and on the plane and in the airport, so I didn't pick up anything. But I have to say that when I've gone to these last few places in France and Spain, they smoke in Europe.
Okay.
And that really sets off my allergies. So I have to say that I always come back with my allergies full blown because of the exposure to smoke. But other than that, I'm actually feeling great.
Now, my question is simply this. When you say eating well, does that mean you a vegan, a tregan, a pescatarian? What does that mean?
I would just say what I've done is I've avoided red meat since the age of 18. So that's like
Okay.
40-something years. And so I eat mostly fish, a lot of
Uh-huh.
veggies, and some chicken.
Okay. So, well, from the Kojic and the saints of God, they are all saying thank you for keeping the gospel bird in your menu. We can get rid of the cow. That's somebody else's sacred thing. But the gospel bird is something that we always have to be concerned about. So, lots of rain, lots of weather in the country and all over. Tell me, allergies, they say, is going to be a mess this year. Tell me, how do we deal with this? Because I got allergies.
I think we all have allergies. And everyone I've spoken to, even where I travel from and since I've been home, are all struggling with allergies. So I would just say the most important thing is probably if you stay hydrated, that helps. But I have to admit, I rely on over-the-counter medications, so some antihistamines to help dry up the drip. I have a postnasal drip, which makes me cough. So everyone thinks I have TB, but really it's just a cough related to my allergies. Sometimes I'll get runny nose, but if I take some kind of an antihistamine, whether it's Allegra, Claritin, Zyrtec, and my go-to drug is Mucinex, breaks up all that mucus and dries it up so I can get on and do what I need to do. Like I'm here today, even though I was all kind of congested earlier today.
So Mucinex is the secret weapon.
Yes.
So let me ask you, tell me about these neti pots. Do they work? Are they good? Should I go get that little thing that's automatic to just stick it up to your nose and it rinses and pulls at the same time?
Well, I do recommend it. I personally can't deal with the neti pot, but I do use saline nasal spray, which is similar. It's just that neti pot I can't get with that saline. But a lot of people do it. I recommend it. And it's good because it flushes out all of the things, whether it's dust or particles in the air that gets into your nostrils and causes the allergic reaction. That rinses it out. So it decreases your chances of having allergic reactions and allergy symptoms. I do rinse with nasal spray, saline nasal spray in the morning. And then if you need to, for us allergy stuffers, is to use something like a Flonase, some kind of a nasal spray that will help settle down the reaction in your nose.
Yeah, well, I do all of the above. I spray at nighttime, and then I chase it with some nasal spray. In the morning time, I rinse it and chase it again, and I take my Claritin and everything. Yeah, because it puts me out, and mine normally goes into a sinus infection and everything like that. And I'm just going to just ask you this really straight up. Now, I was really feeling the little neti pot the one that that automatic that you just put it up and it do the same thing. And then I saw the price.
Oh,
And so then I said to myself, well, will my insurance take care of it? And they looked at me and they was like, So guess what I don't have?
a neti pot.
I don't
an
have
automatic one.
that. I know. I said it was not in my budgetary areas at that time. But I kind of want to know about insurance. Because it seemed like as much money as we that are retired got to pay for insurance, those that, don't have that automatic state pay insurance, And for those of us that maybe have some and maybe don't have enough, don't you think that the medical field and the folks should give us more for our insurance dollars? And how does it really work? Because, I'm distressed every month that I look at it and I couldn't get a neti pot, as much as I'm paying for my insurance.
Well, you're right. And most people are frustrated with the fact that most things aren't covered, but they do go about covering the basics.
Okay.
So if you land up in a hospital, they should pay for that. If you go to your regular appointments, they should pay for that. But smaller things, they don't necessarily cover. And that's the reason why I bought.
Well, I'm gonna bring my friend in on this, but I'm getting ready to see, because I had a little situation where I went to Kaiser, and because I went to the emergency room, they said I had to pay $100 copay. I'm like, what? I've been here for a couple of days now. Just because you ain't moved me to the room. And so they was like, well, it has to be this, it has to be this. I said, the devil is a lie. I looked at the person, the registration people, and I said this. I said, look, I pray that after you take my money, you're going to have to refund it. Do you not know that yesterday they refunded that money?
Yep.
And I said, won't God do it? See, y'all got to pray on your insurance carriers.
But you know what? The reason why you got it reimbursed is because if you are hospitalized after an ER visit, then that counts towards that. So if it's an ER visit and you head out, you have to pay that copay. And some people pay $50, some people pay $100. But if you're hospitalized, that's washed away.
Well, see, they were playing games with me, because they said I think they were thinking, as long as we keep them down here because the beds aren't available, then he said. But somebody finally came with some reasons, said no, we done saw that we didn't move him up because of this. But anyway, with that being said, Sister Gordon,
Yes, sir.
I got to ask the question. What is insurance and what is medical insurance? Who got it, who don't, and what's covered? But I'm going to start with the basics.
Okay.
Can you just explain to me Medicare versus Medi-Cal?
Oh, absolutely.
Yeah.
So, great question. Medicare is typically what is provided to our seniors. So once you're age 64 and 9 months and up, we qualify for Medicare.
Wait a minute, hold on. Wait a minute. Why can't I just be 64? Why I got to be 64 in 9 months? What's the 9 months got to do with it?
Honestly, I don't know. It's a government thing, but it's for that particular age group when they can start signing up. There are other
so they don't get it till they're 65. They want them to sign up at 69 in 9 months, and then 3 months later they might have it.
Usually that's how it works.
Okay.
Yes. But there's also some qualifiers for younger patients. So when they have certain chronic conditions that qualifies to be on Medicare, they also can become a Medicare patient as well.
Okay, can you give us some examples? Because I want to know, is hard-headedness one of those things that...
No.
Okay.
Unfortunately, there's no ICD-10 code or diagnosis for hard-headedness.
Okay.
But usually we'll see patients with certain mental conditions that qualify, potentially bipolar with some serious chronic illnesses like repeat hospitalizations. A lot of strong chronic illnesses can usually qualify, and most of the time it's some sort of disability that usually qualifies someone to be on Medicare.
Okay, and so basically Medicare is for the folks that are 64 and 9 months of age. They can apply for it. Now, what happens? I hear people say, well, I applied for it, but I got denied. What is that about?
Denied from Medicare?
Yeah.
Ooh, we should get an agent for that patient.
Okay.
Because that is a right. You pay into that when you work. So there's an insurance agent. I'm not an insurance agent, so an insurance agent would be the right person to discuss that with, because there may be some sort of conversation to have with like the Social Security office and different government entities to find out why. But usually once you hit that age range, there shouldn't be a reason why you can't get Medicare.
Okay. So that's a bona fide benefit
Yes.
of being 64 in 9 months.
Exactly.
Okay, well, I'm not rushing to get there, but oh, you better believe when I hit 64 in 9 months in 1 hour, I'm going to be on because I want to get a break.
That's right.
Yes. So now tell me this. Medicare, let's go to Medi-Cal. Because, well, no, before I go to Medi-Cal, let me ask about Medicare.
Yes.
So what's all the different plans, Plan B, Plan C, all this other stuff? Can you explain how that works?
Yes. So when we sign up for Medicare, we usually sign up for a Medicare Part A, which covers a hospitalization. So like we were just talking about, that would be under a different plan. And then your Medicare Part B is what is covered with your doctor's offices, your specialist offices, your physical therapy, all of that covers under Medicare Part B. And then there's also, your C and D plans, what has to do with your medication coverage. So there can be some gaps with Medicare usually covering 80% of your different medical bills. And then usually if you have a straight Medicare Part B, it is recommended to have a supplemental plan so that it can cover the other 20%. Now, there is a difference between patients who have straight Medicare Part B and then there's Medicare Advantage. And so Medicare Advantage is usually an income-based program. A lot of times those patients have had a Medi-Cal program before they turned 64 in 9 months. And these patients, they have Medicare Advantage is more like an HMO, and we'll talk more about that, but an HMO where they're assigned to a provider. So our patients who have Medicare Advantage, they're assigned to Dr. Afflalo, and they have access to all of the providers in our office. We run the referrals for them so that they can see different specialists. There are a number of Medicare Advantage plans that we currently take. I'm not sure if anyone saw the news where Scripps dropped a lot of Medicare Advantage plans, so over 30,000 people lost their doctors, but that doesn't mean they lost their health plan. So our office is one of the ones that still takes things like Scan, Humana, Anthem through Medicare Advantage.
Okay, so I just want to let you know that I do, as a person that's growing up the ladder and closer to 60 than he is to 50 at this point, I think I'm just a little offended. I worked so hard, and they said it was supposed to be automatic, but why are they giving me the ABCD of Medicare instead of just saying push a button and we're supposed to get it? Why do they have these different levels, and shouldn't I just get it all?
I agree. We should get it all. And it's very confusing and convoluted to even us in the medical world. So I definitely recommend when that time comes, there are usually tons of Medicare agents this is their job. This is what they do. They're insurance brokers. They can help make sure that the insurance plan that we sign up for is the right fit for us. They'll ask you questions like, what type of medications are you on, to make sure that insurance plan will cover those things. There are some plans that will even offer rides, a certain amount of rides each month to go have doctor visits. So those are going to be the different types of things we want to narrow down to pick the right plan for us.
Okay, so what you're really saying is that when it's time for you to make that decision, get you a good insurance person?
Yes, exactly.
Do we have any people of color? Because they be trying to hoodwink us and try. Do we got any people of color that we have in our stable that we can point people to that will be honest and true?
Absolutely. So every first Wednesday of the month, the health fair that Dr. Afflalo holds at the Jackie Robinson YMCA, there are a number of brokers that are out that are willing to talk, whether they're coming from Molina, United Healthcare, they're all out there. There are numbers that come into our office and meet some of the patients as well. So we have plenty of cards, so we can always find the right fit for a patient.
So
when
what
that
you're saying
matters.
down at the health fair, we got some bona fide Dr. Follow approved folks, and then she don't have no mess down there?
Absolutely.
Well, there you go right there. So for those of you guys that are getting close and you got some questions, if you don't get them answered here tonight, you need to go down to the health fair. That's every first Wednesday, right?
Yes,
It's
sir.
coming up, right?
Next week.
Right around the corner. Am I right?
Yes.
Man, they got groceries, they got rides, they got all this stuff going on down there. Now we find out a little bit more about insurance. Now I got to ask the question because I'm understanding Medicare for the old folks. I'm the seasoned people.
The seasoned.
Yes. And so then what is Medi-Cal for?
So Medi-Cal also income-based, but it's for younger patients. So anyone younger than 64 and 9 months can qualify to be on Medi-Cal based on income. There is a state Medi-Cal, and then there's also Medi-Cals through different insurance companies, like a Molina or like a community health group. So it just depends on what plan fits best with that patient. I would say the most important thing is when we sign up for whichever plan we choose to go for, make sure we have a provider or an office in mind, because that's really how we want to navigate healthcare. We can have all the health insurance in the world, but if we don't have access to a primary care home that's actually going to take us seriously and help us navigate through the confusion of healthcare, then it's kind of pointless.
Okay, so I'm going to ask a question, Dr. Afflalo. Any point, I know she's expert, but you could chime in, but I just got to ask some questions because, inquiring minds want to know. So let's just talk about the incarcerated population. Incarcerated population, they get out, they get they're on parole or whatever. They have no job, no income. Do they qualify for Medi-Cal?
I do believe so. Because of it's income based. So if they're not working, yes.
Okay. All right. So anybody if it's strictly income based, that means anybody under a certain income can get health coverage. Okay. What if, I'm just going to say this, what if, I'm 23 years old and mama and daddy and them kicked me out the house because I got smart mouth and they said that you grown now and get out, and I was on the insurance plan, they took me off. Do I still qualify for Medi-Cal?
For Medi-Cal, yes. Well, they changed the age. So now individuals qualify up to, I believe it's age 26.
Yeah. So
to
he's
be
asking,
on their provider plan.
but he's saying that the parents kicked them off of their plan, but I don't know if they can legally do that. That part we don't know because, they can kick you out the house because you're a smart mouth, but I think you still have to be remaining on their plan till 26.
Yeah.
So if that's the case that they can actually take you off, then you should qualify because the point is we're trying to avoid gaps in healthcare.
Okay.
So, like say the student graduates from college and then they don't have a job yet and they're too old to be on their parents' insurance, they can get Medi-Cal. It's really to make sure that they can't afford the Obamacare or Cover California, then we go to Medi-Cal until they find another niche where they can afford it. And that's where the federally qualified health plans come in, the San Ysidro Health, the Molinas, and the Family Health Centers and things like that, is they are obligated because they get federal funding. They're obligated to take anyone with no insurance or minimal insurance.
All right, now all you parents out there that got them kids that got on your last nerves and they're 18 years old and you got to pay extra because they're on your plan, don't everybody start kicking your kids off the plan because, I don't want them to not have any health care. But, some people have to pay more if their children are on the plan. Right. And so, I would imagine that some people would opt to take their kids off the plan so that they can get Medi-Cal and say, see you alone. But I think that as long as they're in your house or if you claim them as a dependent, you can't do that.
Correct.
Okay? So
Right.
so y'all can't be claiming them saying can't claim them and then kick them off. You got to take it one or the other, make it weigh your options. All right. So let's just talk about insurance in general. I caught something, what I'm saying. Tell me, how does insurance work? And I'm going to ask a couple questions like in these insurance scams. And why in the world does an aspirin cost $5?
Ooh, I don't know why.
That would be at the hospital.
That's what I'm asking.
Yeah, the hospital's a Band-Aid costs $50.
I'm
they
trying to figure
jack
it out.
everything up.
Are they hustling the insurance company? An aspirin, I took two. I took two. I said, what? That's $25.
And then your insurance was like, well, we're not paying that. So now you got to pay it. Yeah.
So explain this whole thing. How does insurance work? Because I didn't ask for no $5, $10 aspirin. I asked for this a straight up buffering. You know what I'm saying?
Yeah.
And I get a whole bottle for $3.99.
Yeah, it's a shame. But basically, when we sign up for insurance, we want to make sure we understand there's a few things. Whether we're going to sign up for an HMO or a PPO. So the HMOs is where we have an assigned primary care provider, and we have to have referrals in order to see specialists. And then there's the PPO where we have a little bit more flexibility, where we can sort of see whoever we desire on our own schedule. The most challenging piece about insurance in San Diego is that most provider offices, it's a wait time of like 1 to 2 months. So that can be very frustrating, especially if someone has a lot of chronic illnesses. They just changed their plan because their job or employment changed. They signed up for whatever and not realizing what all that entailed. Then they go to have to make appointments to get refills on medication. It's like, oh, by the way, we don't have appointments for 3 months. So the best thing we can do when we're signing up for a plan is kind of have an idea of who we'd like to see in mind, and look at the options in terms of what insurance plans they cover, and then what your employer gives you as an option. Once we do that, then we start looking at premiums, deductibles, copays. This is the part, your premiums, which you pay each month to your insurance company.
Crazy.
Yes. And then your copay is what you pay every time you go in to see a provider, whether it's your physical therapist, whether it's your primary care provider. Each of them has the same or a different copay. And then the part that people struggle with the most is the deductible. And so there are different insurance plans where, for example, we see a lot of military patients. They have TRICARE. The TRICARE HMO is TRICARE Prime, and the TRICARE PPO was TRICARE Select. And TRICARE Select, I would say, has the best deductible rates that I've seen of any insurance. The most I've seen is maybe $150 that has to be met. And what that means is, for that year, once the patient meets the deductible, then the insurance will kick in. So if it's a $150 deductible, that might cover one visit. They pay that out of pocket with their copay. They're good for the year. They can come in and have as many visits as they like. They just pay their copay, and their insurance comes and pays the rest. For people who have a $10,000 deductible, most people don't meet that unless they've got some sort of hospitalization and a lot of chronic illnesses where they need to be managed with a lot more care. And so it can be frustrating when we sign up for a plan like that, because it might feel like, well, every time I go to the doctor, I got to pay. I got to pay $200, I got to pay $300, I got to pay $150. But the insurance plan says, unless you meet this $10,000, we're not going to help you. So it's important to understand the difference between premium, copays, and deductibles.
Yeah, because I'm arrogant when I call. I called and they be like, "Oh yes, your doctor's available next month on the last day of the month." And I'm like saying, "Oh well, then she doesn't realize what she needs in her life. Then cancel her out and give me somebody else. But I need to see somebody tomorrow." And they look at me like, but that's not in your plan. I didn't ask you that. The rules say I could change my doctor anytime I want to change my doctor. So I'm changing my doctor. I might change back to her after this appointment, but we're going to have this appointment today. You got my file up? And they be like, so you understand? I say, yes. I think let's talk about, as we talk about insurance, let's talk about advocating for yourself when you're going through this process, because they give you some crazy things. I'm like, don't send me no message that this is going on and then tell me you're going to see me in 3 months. Oh, no, you're going to see me this week. Currently one of my loved ones was at the doctor, and they said, okay. Now, we went there because they saw a red flag. And then they said, oh, well, your doctor's not available until Tuesday. It's Friday. We're going to schedule you in for Tuesday. No, you're going to schedule me today. I'm going to see a doctor today. And I had to tell the loved one, I said, don't you leave there until they let you see a doctor. And the lady heard me on the telephone. She said, man, we will get you into that. I said, well, praise the Lord. So let's just talk about advocating when you're trying to navigate this insurance and making all these decisions.
Yes.
I would just say that it depends on the system you're in. You're describing what, an HMO. I mean, I grew up in the Kaiser Permanente thing, and I would just say that it doesn't matter, even if your provider is not there, there's someone available to see you.
Yeah.
So when I was working there, if I was out for vacation or something, my colleague would see them. We always had a same-day appointment or two available on everyone's schedule. So an emergency comes up the night before the next morning, but it's not at the level of needing an urgent care or an emergency room, but you need to be seen. Your ear is bothering you. You're having a little bit of a stomach ache or something. And rather than it get worse, it's better to be seen. they will put you on someone's panel that day, or not on their panel, but put them on their schedule that day so that you can be seen. And those notes and everything goes right to your primary care provider. So you don't have to see your primary care every single time. If something comes up and their schedule's full, they will put you with someone else at that time. Everyone's capable of seeing you. They should be, to take care of you. Put that Band-Aid on there. Make sure if you have an ear infection, they put you on the right antibiotic. If you having some coughing or something, fever, and they think you have a pneumonia, send you down for a chest x-ray, come back up and put you on something. If they feel that it's really beyond a clinical aspect, send you over to the ER to be evaluated and may be hospitalized. So there should always be in a system someone to see you on that day. And if they don't, you just go right to the urgent care.
Yeah.
And you walk in. I mean, back in the day, you could just walk in. Now they want appointments, but you can still walk in because they really can't deny you care. And last resort is go to the emergency room.
Yeah.
So you don't have to sit with an issue that seems like it's more urgent than waiting until Tuesday. You can be seen. But I like your route better. Just tell them, like, no, you're going to put me with somebody today.
And you know what I really like, and this might sound bad, but sometimes I like the nurse practitioner better than I like the doctor, because the nurse practitioner be like, look, I already know what you're going through, brother. You know, I done read your chart. You know, this happens every time this year. Let me go on and get you set up and everything. Don't argue with me if you already see what's going on. Then many times the nurse practitioner is like, okay, I get it. I see it. Let's get it on. So let's talk about, you know, the difference as you look at your insurance from a doctor versus a nurse practitioner, and what can a nurse practitioner go up to before they got to have the doctor come in?
Yeah, I'll start off, and I'll let, obviously, nurse practitioner Danielle do it. But there are a set of protocols. So the physician should be able to see pretty much anyone, any age group, and any severity of illness. I do know that nurse practitioners are limited, at least back for the ones for Kaiser. They would not be able to see people over 65. They wanted the primary care provider to see them, especially for conditions like shortness of breath, because it could be asthma or wheezing and things like that, but it could be congestive heart failure. And so rather than put that more serious medical condition on a nurse practitioner, it's better to put them with the primary care provider and let them take the extra steps. So I know at Kaiser they had different protocols that the receptions would not book a patient for in the nurse practitioner's schedule, only because it could be something worse. You know, chest pain, we'd want to put them with their primary or physician. But nurse practitioners pretty much can do everything. And they're trained to do everything that we can do. There are things, they just need to be under the medical professional's license. But a lot of times they know more than the physicians are there, because they've got the experience. They did the work in the hospital, and that's what nurse practitioner Danielle can talk to about. They've been by the bedside with the patients. They know that aspect, and then they come out in an outpatient setting, and they understand, yes, they have the empathy. Not all physicians do, and so this is where you get the hand-holding and the empathy and the compassion that you might miss with the primary care, because they're trying to get in and out, and they may have more complicated patients back to back to back, but nonetheless, you get very good care for nurse practitioners and physician assistants, and they can work pretty much on their own too.
Yeah.
So let's have Danielle just kind of give her aspect of all the different journeys that she had to take, but the fact that she can see pretty much everyone.
Oh, sure, absolutely. So before this, I actually worked as a medical assistant, and then I worked as a nurse. I traveled nurse for a little while, and so I've been in hospitals where I've been on stroke floors, cardiac floors, patients on ventilators. I've worked night shifts in the middle of codes, having to wake up the physician, like, I need this drug, this drug, this drug. Your patient's crashing right now, and arguing back and forth, like, okay, I don't have time for this. I'm gonna call the intensivist. I know what needs to happen. So most nurse practitioners have had a great deal of experience before they became nurse practitioners. And that experience really allows us to feel comfortable so that when something comes into a primary care office, we can kind of evaluate, oh, is this urgent? Do you need to be seen here? Is this emergent? Do I need to send you out and call an ambulance? Or is this something that can wait? And of course, being under the mentorship of Dr. Afflalo has been amazing. When something feels out of my realm, she's the phone call away. Hey, I've got this situation, when we talk about it and we make the best plan for the patient. But I can prescribe, I can diagnose, I can help put in referrals. So there's no limitations. That's usually the first thing a lot of our Medicare patients come in and say, oh, I thought I was seeing a doctor. And then at the end of the visit, they say, wow, this was refreshing. I felt heard. I felt listened to. You can do all of these things for me. Okay, this was great. Thank you. I appreciate, coming in. And that's something that's very unique and different for us at IWC Primary Care. We brought up a good point earlier about triaging patients when somebody needs to be urgently put in. We actually have a smart schedule approach where we leave 1 or 2 slots open every day so that we can fit in those urgent visits so that our patients don't have to sit for hours in the ER or the urgent care if it's something that we can handle inside of our office. So that's another thing to think about when we're choosing our health insurance and what type of provider we're going to see. Do we want to call and say, sorry, we're booked out for 2 months? Or, hey, I'm your patient. I've got really bad sore throat, cough. I think I have COVID, right? We know we have limitations on how many days can go by before we can actually treat that patient. We're going to do everything that we can to bring those patients in.
Well, first of all, for some of us, we have to really, when we look at our insurance plan and how we select doctors, everything, for me, I select people based on personality and their record. First of all, I ask people, well, what's your experience? Where you been? And like if you're gonna do surgery, how many of these surgeries have you done? Are you the best, or are you a student?
Right.
Now, I'm not saying students is bad, but like I said, if you're gonna give me the best, I want to pick out my anesthesia. I want the anesthesiologists that didn't lose no patients from overdosing and everything like that. And I had a lot of needs. So my doctors, when they come in, one doctor used to come in and be like, how about them Lakers? Because he knew that was going to be the first question. Man, did you go to the game? I'm still waiting for my box seats with you, but but the thing that I would say is, as people begin to navigate, and I always say with IWC Primary Care, I just have to give you guys kudos because you have a great appealing staff, from the heart of your staff to the personality to we're doing this show live and the team is on there answering people's questions. Y'all ain't been able to answer because we got a team member online that's answering all the questions. But see,
We stay ready.
Yeah, that is the way that IWC Primary Care is. How did you get available to have so many opportunities for the insurance policies? And do you accept everything, or do you say, look, we do Medicare, we don't do Medi-Cal, or what goes on there? Can I if I got what's that thing, Kaiser? Can I come over and come to your clinic? And
Ooh, that's a good. So in certain cases, yes.
Okay.
If the Kaiser plan is an HMO where there's an assigned provider, unfortunately, no. But if the Kaiser,
wait a minute. But in the assigned provider, when you say assigned provider, you saying assigned doctor?
yes.
Okay. Well, what if I fired the doctor and I don't have no assignment? I'm just free.
So a Kaiser PPO, yes. So there's a new contract with Kaiser and Cigna where, especially I think they created it because of their rural areas where people couldn't access all of their Kaiser providers. And so in those situations, the Cigna contract comes in place, and we are contracted with Cigna. So there have been a few times where we've had an urgent care visit with a Kaiser patient who had a PPO, and they'll pay for like their COVID test and have a visit with our providers.
Okay, stop. All these initials. What is a PPO versus an HMO?
Good. So PPO is a preferred provider organization. And earlier we talked about this is the plan that you can select to say we don't want to pick a primary care provider. We want to have flexibility with who we choose. So some of the PPOs that we accept currently include Cigna, Aetna, United Healthcare, technically TRICARE Select is a PPO. Trying to think if we have any more. There are others that are coming, multi-plan. And then an HMO.
Okay, wait a minute. So all you PPO people, you can go to, with no problem, from what I understand, you go to IWC Primary Care, and the PPOs y'all in. Now help us with the HMOs.
Yes. So an HMO is a health maintenance organization, like a Kaiser.
But they ain't maintenance me the way I want to. If they're not maintenance me the way, can I go over to where I get maintenance at and they still pay for it?
No.
Unfortunately,
It's a closed system.
Yeah.
The Kaiser that you're in, it's a closed system. Everything is within that system. All the referrals to all their specialists, the hospitalizations, the surgeries, everything, the pharmacies, all within the Kaiser system. So you can't really go out and date somebody else out there. You
Oh,
gotta,
okay.
yeah,
So
you gotta
see,
stay
I
within
like
the
how-
family.
Okay, you have to stay in the family. So wait a minute. What about sharps?
Yeah, that's different.
So the Sharp HMO version would be Sharp Reestealy. So it's kind of like Kaiser.
Similar.
Everything's in one building. You all
So if you were sharps, you just kind of.
well,
Sharp
if you're with Sharp Reestealy. So
Reestealy.
Sharp has two different types of plans. We can sign up for Sharp Reestealy, which is like a Kaiser, all in one
What
spot.
has Race Daily got with sharps?
I don't know who
They
this
starting
Reestealy
trouble.
is.
Okay, go ahead.
And then there's Sharp Community Medical Group, which is for the most part a lot of primary care private practices that are within the Sharp network that allows our Sharp patients access to that same primary care provider under the Sharp umbrella, so we can refer to a lot of the specialists within the Sharp network.
Okay. Now, people are asking about budgets right now. They say which one is more economical, a PPO or an HMO?
Very good question. Usually HMOs.
Okay.
HMOs usually have a lower out-of-pocket cost because there's not usually a deductible that comes into play. PPOs are where deductibles come into play, and there's usually there can be good PPOs, and then there can be the high deductible plans for insurances. And those are the folks that may have a $10,000 deductible where they feel like they're paying cash every time they come to a doctor's office and they're just shelling it out.
And sometimes I think the deductibles have a lot to do with the premium. So if you try to choose a plan because you can't afford monthly, you get a lower premium, but you end up having a higher deductible.
Yeah.
So you pay one way or another.
Well, see, can I say this? Can I call it like a buffet?
Okay.
You know, when you go for a buffet, you got to pay a big price. Say you go into Vegas and you go get that seafood buffet,
Yes.
and they say it's $120. You try to eat as much as you can to get the full $120.
Yes.
Right? Now, am I wrong to make sure that sometimes I just go to the doctor just because I'm going to get everything out of what I do? There's sometimes that I got supplies that's sitting in the cupboard because at 6 months they say I get new stuff, even though I might not need it, but I'm going to get every bit of my HMO thing.
Right.
Is that wrong?
No, you paid for it.
Okay.
And a lot of times, a lot of our patients will come into the office and we can tell there's been that sort of heaviness on their chest. They've dated other primary care providers. They've been whisking for 5 minutes, then whisked out and felt like, oh my God, I don't know what just happened, but I'm out of here and I still don't know what's going on. And so, again, not to plug IWC again, but that's one of the perks.
We gonna plug.
We're gonna plug. Okay, we're gonna go all the way in. Our patients come in, especially for a new patient, they get an extended visit. 30 minutes is what we get with the provider, and that really allows a lot of time to build a rapport and trust with their primary care provider. Make sure all of the needs are addressed, and no one has complained. Most people leave feeling like, wow, that was thorough. And I actually had time and I didn't feel rushed to talk about things. I'm excited to come back again. And I feel like I got my money's worth because I'm paying this premium. And so it's really important that we choose, our insurance plans, especially for the HMOs, choosing a primary care provider who's going to give us that service, because health insurance is not cheap. And so we want to make sure it's an investment that's going to give us quality back.
Yeah, and I tell people that when you are blessed to have insurance, whichever way you have it, it's important that you take advantage of it. Now, I think I told Dr. Afflalo at the first of the year, I don't even wait for my doctor to call me. Yes, I need labs, and then 3 months in, I'll go again. Yes, could you order me labs? And every 3 months, I tell them order me labs. And one time my doctor said, "Are you good? You don't have to go back for 6 months." I said, "No." I said my plan said I can have as many labs as I want to.
That's right.
I need my labs. Go ahead and do it. I go in, sometimes I just walk past the hospital and say, they got the best breakfast burrito. Let me just go and get a burrito over there because it's cheaper over at that. So how do we change the mindset of how inner city people look at going to the doctor? And because sometimes we have a thing, I go to the doctor when duct tape and all the rumors, all the remedies that we learned over the years don't work. That's when I go to the doctor, and then it's too late. And I'm like saying, but if you got insurance, go. You got a splinter. Oh, it ain't healing right. It don't look. I'm going to the doctor. You know what I'm saying? And for me, it's more time get enough time and not let it be time consuming. But some people are just afraid to go to the doctor. They say, because if you don't know, then you don't, then it ain't happen. So let's talk about maximizing our insurance opportunities.
I think the reason why a lot of our people don't go to the doctors because they're not respected. They're not listened to. So they're afraid not only of possibly a diagnosis, but they're really just they've been there, they've been mistreated, disrespected, and they don't go back. Of course, to the detriment of their own health. So it's really about educating them. They don't realize they don't have to be stuck with that provider that's disrespected them. I tell everyone when I meet them in the community, because I feel like I am an advocate, fire that one, hire another one. And you have to find someone who's going to be an advocate for you, who's going to help you navigate the system, because health plans are not easy. Health services are not easy to navigate. And there's always going to be a no somewhere, but you can find a yes. So I would just say you have to find a provider that you have a symbiotic relationship with, that they're going to have your back, they're going to tell you what you need to do, and make sure they're educating with the best opportunity so you can make the best decision for your health. So if we can just get people comfortable with saying that, this doctor's been disrespecting me, so I don't go back because of that. It's like, let's find you someone else. And then they actually don't mind going in. So that's the first barrier that we have to get past. And then, yes, if there's some people that are concerned about a diagnosis, the problem is you have to show them the other side. It's like, look, if you wait until it's too late, you have no opportunity to take care of it. If you screen early and continue to do your routine screening annually or whatever you need to do it, catch it early, you still have life. There's a fighting chance of getting past this, whether it's a surgery or a treatment, and having some quality life afterwards. So we have to change the mindset by educating them, but also getting rid of the myths of, some people not caring. Yeah, there's a lot of doctors out there that don't give a hootenanny about their patient. It's a numbers game. They have to check the boxes. We get lists of things that we have to do. We don't really care about the patient. We just keep doing it. But there are physicians out there and nurse practitioners and extenders and all kinds of providers that do care about the patient. They went into it for the right reasons, and they want to make sure that you have the best health. So I would just say find someone that you trust and respect, that respects you, and then it'll be a lot easier to go ahead and encourage them, and they'll be willing to do it, to do the proper testing, their routine screening, their mammograms, their colonoscopies, their this and that, and then they can stay ahead of their game. And we won't have to let the diabetes get to the point where now we need an amputation. We have, there's only black and brown people in dialysis units. I don't know if you've ever passed through one, but there's hardly any white people there, because they take care of their stuff, or they have access, and they go. We don't go. We don't take care of our diabetes till it gets to the point where it's out of control for too long, and it affects all our end organs. So our kidneys fail us. We're on dialysis waiting for a kidney for 10 years. We have amputations and things like that. So we just have to continue to educate our patients, and telling them that if they feel like they have been mistreated, not heard or whatever, just leave that one alone. Go to the next one. You can find someone, word of mouth. They'll say, oh, no, I love my doctor, and then find out if you can get on their panel.
And that's what I always tell people all the time. Don't let your arrogance offend my arrogance, because I have the power of the see ya, bye-bye, choose another thing. Y'all got choices. You got options. So you have to advocate for yourself and never feel that somebody knows so much that they're going to tell you what to do. And I'm going to give an example, because my mother, they told my sister, boy, when I tell you an advocate, they told my sister, look, your mom's going to have to go to dialysis every day. And my sister looked at her and at the doctor and said, okay, well, we'll do it from the house. And the doctor said, that's impossible, this, and everything. This was 10, 15, 20 years ago. It's impossible. It's not doing it. My sister did her own research and everything like that. And she says, okay, well, we have the home dialysis machine coming. We've got people trained. We've gone to class and everything. So, and the doctor asked her, how did you find that out? She said, well, we do our research, and thank you so much for convincing me. That was the question I need you to ask me. You are now fired. He said, I'm the head of the department. She said, well, get me the one underneath you, because you're not going to work with my mother anymore. And so it's so funny, because people feel like because you have the title or the position that, I'm the chief of this body over here. And if you can't work with me with this body, then I'm going to find somebody else that's going to work with me. And then I go go get to my personal. See, I have a personal advocate and physician in the community that after I talk to all these high powered doctors and everything, I call my personal advocate physician, and I'm like, personal advocate physician, what do you think about that? And she gave me the whole rundown and said, oh yeah, they did right. I said, okay, I don't have to go off nobody. No, you good. Okay, thank you. And that's what we have with IWC. That's what we have when we have the clinics and the what do we call it? The health fair. The health fair every first Wednesday is that you get real conversation, real talk, real experiences, and there's no dumb questions. You know, and so what is this saying? You know, you want a test run? Come over to the clinic. If you feel in a certain way, you can't shake a headache. Come over to the clinic. You know what I'm saying? But if the headache been going for 2 months, go to the doctor.
Right.
But if the clinic's the next day, go to the clinic.
Absolutely.
And they'll give you all of this. Now, gotta ask some questions. Can I ask some questions?
Sure.
Okay. So as people are moving forth and they're looking at their insurance policy, let's talk about young people. Okay. Young people that just graduated from college, starting their first job. Their job got some insurance, but they have a choice. And you know us. The first thing that they do when you go to the job, they give you this big old package. And the reading goes on and on forever. They want you to sign tomorrow, but they done gave you 4 weeks of reading. How does a young person that is feeling pressure navigate and pick the best one? What are maybe some of the key things that they should look for in picking the insurance when they're a new hire?
I think the first thing is pick your provider first.
Okay.
If we know, for example, we want to be seen in IWC primary care under the leadership of Dr. Afflalo, then, okay, let me start here. You can call our office. You can go to our website, www.iwcprimarycare.com, look at our list of insurances. And if that employer accepts or offers one of those insurances, that's where I would start, because that's going to alleviate a lot of the headache of having to do the runaround between this office, and this office, having to wait. Then we want to start looking at those premiums, those co-pays and deductibles, because every 2 weeks or however often we get paid, that premium is going to come out. And so if we aren't understanding or expecting that, it can be a shock. So start paying attention to the premium and what's in our budget and what we can afford. That's how I would start and navigate that system. And then, of course, if we have certain provisions, I know a lot of times right now everyone's into the weight loss phase and they want to do a lot of weight loss medications. Some insurances are all on board, and some insurances will flat out deny, even if they qualify, they just don't cover that. So if there's something specific that we know we're interested in, even as a young person, start looking at, okay, what are the coverage plans? What are the formularies for these different drugs that I'm potentially interested in being on, in order to know that you don't have to go fighting. We'll fight and bat for you in the background. That's what our office does. But some insurances are like, okay, you can appeal this 10 times a day. We're still not going to give it. So those are some important factors to consider when we're young and not quite understanding how insurance works.
Okay. You threw a thought out there that I'm going to hit on, and then I'm going to come back for the next phase about this insurance. So, Dr. Afflalo, I think that our next show should be on weight loss drugs and all these little quick fix schematics, things that people are having. And because I got my own opinion as a man that is heavier than I should be, I'm working on it, y'all. Y'all don't judge me. You know, I'm working on it each and every day. You know, praise the Lord, amen. But with that being said, I personally refuse to get into this whole, quick lose weight quick, and I didn't gain weight quick. So losing weight quick just mean that whatever they gave me to get there, I got to keep that. And then the minute I stop, it comes right back because I've never learned discipline. But we'll talk about that next time. But I want to ask so far is we talk about medical insurance. Do we ever combine or talk about medical insurance, life insurance, and Afflalo? What is that called? The additional or
supplemental.
Supplemental insurance. Yeah. When you get hit by a car, you can't work, and they kick it in. So, how do we balance that? And is that something? Because I personally, when I was young and spry, I got me some life insurance. You know what I'm saying? And I was young, and it was real inexpensive. But then when time got a little hurt, I let it lapse. Right when I should have just kept it going. I picked it up later, but I'm just saying I should have kept it going. While we're talking about medical insurance, what additional things should they add in that insurance package to make sure that in the long run, because that my mom said keep on living, you'll get there. You know what I'm saying? But a lot of people forget that they got to keep living. So they don't prepare for the keep living. They only prepare for the right now. So let's talk about some additional insurances that should be recommended right along with the health insurance.
Life insurance for sure, but one thing that a lot of people don't think about is long-term insurance, which you don't think about because, I'm young, I'm healthy, whatever. I think I started mine at 38 or 40. Didn't know at the time that I needed it, but once someone explained it to me, it's if you actually do get sick somewhere along the line and you can't take care of yourself, it provides a set of funding to help you stay. Say you even have a stroke at a certain age and you can't work anymore, but you need someone to take care of you. You can't take care of yourself. You need coverage. So you need someone to come to the house or pay for your extended stay over in a nursing home or something till you rehab. Long-term health insurance is very important. And if you don't have it, you're going to find out that you really need, because now you're coming out of pocket. Now you have to sell your house and you have to do everything in order to pay for someone who has long-term care issues.
Yeah.
And unfortunately, young people don't think about all that because they're just healthy and that's not in the forefront of their mind. They barely take care of their health anyway. So thinking about life insurance and long-term health insurance doesn't make sense to them when they're healthy. But someone needs to educate them early in the game to say, get in on the ground floor. Whatever I was paying back then is the same price I'm paying now. Had I gotten in at 67 years of age, I'd be paying through my teeth. So you have to start those things young, and you have to not allow it to lapse so you can stay at a low premium and still afford it. Because I promise you, you rather have it and not need it than need it and not have it.
And I tell people all the time, I propose it as this is the come up. This is where you begin to build generational wealth, especially with life insurance. But when you have those extra things that pay you, see, what folks don't understand, you got to read the fine print. And the fine print says that if you are unable to work, then that kicks in and they pay you your salary, right, of what you would have normally made. But if you work for like a government organization, they still got to pay you, but so does the insurance. So you could be doing double for your money sitting at home because of the fact that you have the plan and insurance. And so just like for some of us, COVID didn't hurt us because we were the first responders. We were doing this and we were doing that. We diversified out. We have to realize that as we get older, you know what I'm saying, we have to realize that those things can help us make it through some of the tough times.
Right.
And then with life insurance, is just that. It can help you where you can cash in on some of them, but more than anything else, I tell all the parents, with the parents, with the little kids that you want to kick out your house, the minute that you can buy them some insurance, buy them kids some insurance, building generational wealth. And then I say, kids, be smart enough to say, Mama, I'm expecting you to leave before I leave. So let's get me an insurance policy on you. You know what I'm saying? And that's what we're seeing in other cultural groups, that they are getting insurance policies and paying the premium in the kids' names for grandma and cousins and aunties that are at that space. And then when they do pass, there's this big coming money into their chamber. So there's all kind of ways of how insurance is going to be good, but medical insurance is so that you don't wind up ultimately losing it all.
Right.
You know what I'm saying?
Yeah.
And so it's not an option, it is a necessity. Just like you got to get a car, that's an option. You know what I'm saying? Eating is not. You know what I'm saying? And so when you look at it, is that the insurance is good for not only a peace of mind, because there's sometimes that I get up, now I'm 59 years old and proud of it, praise the Lord. There's sometimes I get up and things pop, and you stop, just like you see something on the wall, you stop, and you be like, okay, now I'm gonna try one more move, and if it don't beat me, I'm gonna sit back down, get on the telephone, thank God for insurance, and say, look, I need an appointment.
Right.
That's the power of understanding insurance and everything like that. And then understanding that what does insurance cover? Now, we just think medical, cut up, everything like that. But what about our mental health? Can insurance cover that too?
Absolutely. So a lot of mental health actually happens in primary care.
Okay.
So we diagnose and treat anxiety, depression. If there's something outside of that what we're concerned about, we can send a referral to a psychiatrist. If we're going through a rough time, we can send a referral to a therapist. So there's a lot of individuals within the network that qualify under the insurance. So again, that primary care provider is key to navigating where to go. Something that we do and we pride ourselves on, as you heard, Dr. Fallow's like, oh, they're not working, we need to cut them. We will cut referrals from our referral specialists from our list. So if this psychiatrist or therapist is not working well, and we're hearing this from a few patients, it wasn't just this one encounter. There is a trend happening. And we don't want to endorse anyone by giving a referral to someone that's just not meeting our expectation.
So my last question to the team is simply this. You know, when I go to Vegas, I always tell people to bet on black. You know, say you can never go wrong with betting on black. If I come to IWC primary care and say to you, look, I need everything I do, I need it to be a black person. Can you navigate me? I need a black psychologist, a black psychiatrist. I need a black phlebotomist. Can I just bet on black every time? Or do you, or is that even an opportunity?
We're getting close.
Yeah, they're not enough black people in San Diego to fit the needs of all of that. So we try to find if there is black and they are worthy, because I'm telling you, not all black folk is your kinfolk. They don't necessarily
all skin folk ain't kinfolk.
That part.
So they don't they might not be the best choice for you, but we find the best person. And sometimes they just, the package they're in doesn't look like us, but they provide excellent care. And they're empathetic and compassionate. They would treat you the way how we would treat you. And that's what we're looking for. So it doesn't matter what the package is. Of course, we want to go black if we can, but they have to meet the standards. There's a criteria that we set. And if they don't meet that, we don't go there.
Well, I'm going to leave with this, and I'm going to say that, and I'm going to give you a history lesson. Since all life started in Africa, we can say that, well, if life all started in Africa, they got something in them that will qualify them to work with you. But I say, look, they got 1/8, 1 second, they got a quarter this. We're going to figure it out, but we're going to make it work for you. Any final words, ladies?
Come out and check us out at the health fair next Wednesday. Wednesday, May 1st, that's Jackie Robinson YMCA from 10 to 3. We have all kinds of services out there. We just want to see you. Come get some free groceries, but also come and get your blood pressure, your diabetes check, cholesterol. It's Mental Health Month. Come and speak to one of our mental health providers out there. We've got at least a few vendors out there that deal with mental health.
Wonderful, wonderful, wonderful. And I need a plug for IWC Primary Care.
So come on out and check us out at IWC Primary Care. Our phone number is 858-648-0755 to schedule an appointment. Take a look at our website, www.iwcprimarycare.com. We are simply providers who listen, providers who care. Our staff are super friendly. Our warm environment and our new facility has been by none what patients have been dying for. So we're just excited and thrilled to be able to offer that to patients. And so come check us out. We'd love to have you. Yes,
and I'm going to tell your CEO and all the folks, you tell them I need to get a jingle for y'all so everybody starts singing it all around the city. IWC Primary Care. We'll figure it out. But I want to let you all know this is from the community reps and the community advocates that love you, that they're passionate about getting this information out. This is from Dr. Afflalo. We call this Ask Dr. Afflalo. We got our team member in here. I'm so churchy. I'll be like, Sister Gordon, but nurse practitioner.
Yes.
Nurse practitioner, I'm going to give her all kind of titles, but nurse practitioner. And the beautiful thing that I love about this is a family-oriented, family-connected business. Overall, the team works together. This is the spot that if you don't feel like no one else cares about you, about how you're going to do medically, how you're going to navigate this, this is the team in the city of San Diego. And I want to say for all you guys around the world, don't be jealous. You can call IWC Primary Care and get some advice too. And, you might be able to come down and, get some services. But until then, they can help you navigate in your own city. Well, any final words, ladies?
No, we're good. Thanks for having us.
All right.
Thank you.
Again, another great show with Ask Dr. Afflalo right here on GODRadio1.com.